Therapeutic bodywork can be extremely helpful for pain and other kinds of conditions where there's some sort of soft tissue dysfunction. I want to say 80% of the people that I work with come in because of some kind of pain issue somewhere in the body. And there's a lot that can be done working with soft tissue to help with those types of situations. So I'm going to give just kind of a brief demonstration of some of the techniques I use that draw from Tuina, which is the system of bodywork that belongs to Chinese medicine that I'm trained in, as well as Shiatsu, just to kind of show some techniques I work when I'm working with different areas of the body. So for example, if we start with the shoulder, if someone was coming in with shoulder pain, we can incorporate a little bit of acupressure point work into the shoulder. So if the shoulder's tight in this muscular area between the shoulder blade and the spine, this rhomboids group, just holding a couple of acupressure points incorporated into a bodywork treatment can help to release and open up those muscles. Another technique just to kind of open up and release the muscles going down the spine is butterfly kneading. These are all things that I typically do before I actually put an oil medium on the body to do more traditional types of massage strokes. You can do some of these techniques just without any kind of oil on the body, and it can be really helpful to help warm up and loosen up the tissue. This is a kneading and grasping technique around the muscles of the neck, something that can be really helpful if someone comes in with neck pain. And then similar technique but applied to the shoulders, kneading and grasping the shoulders to kind of help release the trapezius muscle, which is very commonly tight in people with neck and shoulder pain. And I'll just show kind of one more here, kind of a rolling technique, double-fisted rolling kind of down the spine. Again, kind of gives some compression and increasing blood flow to the muscle tissue along the spine. And then you can kind of follow that with a kind of a kneading technique going back up the spine. And so kind of a way to just quickly work through the entire back and evaluate what's tight and start to kind of treat before I get in and do more specific work with oil. Cupping is a technique that I use with around 60 to 75% of my clients. It can be really effective at helping to just give an extra layer of work to the soft tissue around the joint spaces. It's a great myofascial technique, meaning that it'll work on both muscle tissue as well as connective tissue. Connective tissue, which includes things like ligaments and tendons, can be more plastic in nature and usually doesn't respond just as well to the different massage therapy movements that can be applied to muscle tissue. So using cupping can be just another technique to help open up the joints, get better mobility, reduce pain, bring greater blood flow, and release adhesions or stuck layers of tissue that are bound up in injured areas or areas of the body that have range of motion restrictions. So I'm going to demonstrate what cupping looks like. First of all, I'll kind of show what a cup looks like. Pretty simple, just looks kind of like a little fishbowl turned upside down glass object that goes on the body. The way that the suction force is created is by inserting a flame inside the cup, and then it goes right down on the surface of the body and creates an upward suction force, bringing the surface layers of the skin and soft tissue into the cup. The style of cupping that I'm trained and that I do is called fire cupping. So I'll just kind of give a brief demo of how we do this here. Okay, so if we're going to treat a shoulder on someone, generally I'm aiming for specific acupressure points around the shoulder that I'm going to be placing the cup. So in this instance, we're going to place the cup right here. And one more cup here. We're going to treat kind of this rhomboids group. This is essentially how the cupping techniques work. So as you can see, they're on there pretty firmly. Normally I leave the cups on for about 10 minutes, sometimes a little bit longer. There's techniques that you can certainly do beyond just these stationary cupping techniques with the cupping. Another one would be to apply oil and kind of move it around muscle groups, which I will also sometimes do. Just to show quickly, one other cup that I sometimes work with for smaller joints that are harder to cup with the glass cups would be these silicone cups, and they're super gentle and easy to do. You just pop them on the body, there's a little suction force, and so, for example, if I wanted to treat wrist pain as well as shoulder pain, I might switch it up and use some of these blue silicone cups to work with the smaller joints. Generally, when I do cupping in a session, I'm working an area with the cups while I'm actually moving somewhere like the low back or the arms or the legs, just a different part of the body, to kind of integrate that into a continuous treatment session. So that's my demonstration and explanation of cupping therapy.